thanks for coming, and congratulations Northern Beaches for doing this. I used this to get the Honourable Philip Ruddock to a meeting about dementia-friendly communities. When he was a bit reluctant, I said, Northern Beaches are already doing it. Oh, okay, so we have a meeting now. So well done, and it's good. We're getting there, so yeah, I've only got 15 minutes, and I'll try and cover a little bit on successful ageing, and then talk a little bit about dementia. But I'm looking around and thinking there's already people here who are successfully ageing, so that's really good. Hopefully you can learn a little bit. Do you all realise in Australia that every year we add an extra month to our life expectancy? So every year we live a month longer. And this is the graph. Light blue for the females, dark blue for the males, and it's still going up. Now, in America, it's flattened off and is going down, and interestingly enough, Mexico is going up and will be ahead of the US before too long. So they're going to have to import people before too long from Mexico, which is kind of ironic. And you can see men in Australia on average live to 81, women to 85. So I just want you to remember that age. But before I move to the next slide, I would love to see at what age people in this room would be happy to drop off their perch. 75, 80, 85. We've had a couple of, okay. 90, 95, 100. We have some brave souls. Okay, so there was no one before 85. Now at 85, 1 in 3 of us have dementia. At 90, it's 1 in 2. So if you don't have it, you're living with someone that does. And that's really important to remember when you think about our future. So I love this picture, the Fountain of Youth. Wouldn't we love to find it? I have colleagues in the US and Europe who actually think in Australia we have found it because of that life expectancy line that's still going up. But what interests me with this particular painting is that it's all women. Sorry guys, but we don't have the Fountain of Youth, that's the way it is. But we do have people who've aged successfully, and I just want you to look at a few of these photos. None of them are faked, they're all real people. And then I want to ask you, what have they all got in common? Now, you probably won't be able to pick that easily. We've got everything from obviously a very elderly lady who you will meet in a minute, an elderly cyclist, the gentleman who holds the, I think it's the 95-year plus pole vault title, Tai Chi, a couple chasing their sheep, and the gentleman at the bottom right-hand corner is running the London Marathon. I've forgotten his name, but he's done it a few times, and I think he's 98, something like that. So we're never too old. So, as I asked before, what do these people have in common? They're all over 85. They've all exceeded their life expectancy. They're all outside and being active and engaged in activities outside, if you like, normal activities for 85 plus year olds. And I think that's really important. Why do we sit down when we get old? There's no reason to do it. They don't do it in other countries necessarily. They have not let age get in the way of doing what they want to do. And I think that's incredibly important. So, how do we stay fit and well into our 80s and 90s? You know, how do we live well until we die? Ideally, we drop dead on the golf course, the bowling green. As one gentleman said, he wants to drop dead in Coles because he wants to get his revenge on having to stand in queues for long periods of time. I thought that was good. And how do we avoid the unpleasant conditions of older age, such as dementia? So, I will talk a bit about that in a minute. But I want to introduce you to my pin-up girl. Madame Jeanne Calment is the oldest living human. She's actually died now. She died in 1997. She was 122 and a half. And just have a look at what she did. So she took up fencing, as in the fencing sort, not the paddock sort, at 85. She rode a bicycle till she was 100, and then she had to stop because the gendarme took her bike away because she had macular degeneration and kept running into people. She lived alone till she was 110. She had a large glass of port wine every day. Now, the 2 cigarettes a day is interesting. She had to walk up and down 3 flights of stairs to smoke them. So she probably got more exercise. She probably did more good than bad. And a kilogram of dark chocolate each week. She did give up smoking at 120, and a couple of my smoking patients said, well, there you are, it killed her. She poured olive oil on her food, Mediterranean diet, and rubbed it on her skin, and she outlived husband, child, grandchildren, but not great-grandchildren. And she died at 122 without dementia. So I think that's quite important, because often we think it's inevitable that you will. She was active and involved, and I think that's really important. So what do we know about successful ageing? And these are taken from 4 centenarian studies. So 4 studies looking at people who've lived well past 100 and are still going strong. And that's in Okinawa, in Sardinia, in Australia, and in New England in the US. So I've just distilled what clearly were the factors that allowed people to successfully age. Now, the first one is having the right genes, so that's something you can't do anything about. But clearly longevity is hereditary, and if your parents live to old age, likely to do the same. So that's important. The second one is really interesting. It's have the right personality. So be the glass half full sort of person. Be positive, not negative. And I think those people that really get uptight about just little things are the ones who are going to die early, which is probably a good thing. You know, seriously, if you can, you know, they say don't sweat the small stuff. You know, worry about big things, but be positive about life. That is really important, so reducing stress. Be physically active, and that is terribly important, really is. Be mentally and socially active. Being here today is brilliant. You're being socially active, and hopefully you're being mentally active. Eat and drink well. We talk about the Mediterranean diet as being quite positive. There are others with good results as well. And drinking well, I'm a gin and tonic girl myself. Thank you, Kate Fredericks. You introduced me to it. That's why we're going so well, yeah. But you are allowed to have some alcohol. We say 2 drinks a day, but at least 1, preferably 2 alcohol-free days a week, just to prove you're not an alcoholic, and also you save a bit of money on those days. Maintaining independence, so not accepting help is really important. We often think for older people, oh, you should get a cleaner in, you should get someone to help you with your shopping or your cooking or whatever. That is disabling people. And so the thing is, stay as independent as you can. Keep going out, keep driving, keep doing what you can, and don't accept help except for short periods of time while you actually need it. And finally, avoid disease. And I know that sounds pretty silly when you're older, but there's a whole lot of things you can do around diabetes. Things like making sure you have your flu vax every year to avoid getting the flu, getting your blood pressure checked, having your bone mineral density checked, a whole lot of things you can do at all ages to avoid disease. So I think that's the positive message. I was then asked to talk about dementia generally, and before I do, I'll give you the definition, because there's often a bit of confusion. Dementia comes from demens, meaning without mind, and I guess that's in a way what happens at the end. But dementia is the generic name for the progressive, irreversible syndrome of impaired memory, intellectual function, changes in personality and behaviour, and they all, or together, they cause a significant impairment in function. So if you occasionally can't remember which row you parked the car in, or occasionally forget where you put your car keys, or like one of my lovely patients got sacked by her bridge partner, but you're still functioning well, that is not dementia. It's important to say that you need to have changes in day-to-day function. You need to not be able to use a mobile phone, not be able to work out how to put the keys in the car when you eventually do find it, or the police find it for you. It is quite important to understand that. So that's dementia generally. In Australia, the commonest cause of dementia is Alzheimer's disease. And they're often used interchangeably because about 70% of dementia in Australia is due to Alzheimer's disease. Alzheimer was a German pathologist from southern Germany. He described his disease in 1906. We are now 112 years later, and we still don't know what causes it, and we still don't have a cure. How many other common diseases can we say that about? So it is a real issue. So Alzheimer's disease is the most common. Vascular dementia used to be called stroke-related dementia or multi-infarct dementia, which is often can happen after small strokes in the brain or after a big stroke. That's the second most common, but really I think, especially for people over about the age of 80, mixed dementia where you get a bit of Alzheimer's and a bit of a few vascular changes. That is what we often see in people's brains when they live, past 80 into 90. Dementia with Lewy bodies is interesting. Lewy was a German pathologist who happened to be a student of Professor Alzheimer. He described little pink bodies in the cells in brain cells. If you have them in the back of your brain, you get Parkinson's disease. If you have them in the front of your brain, you get dementia with Lewy bodies. Some people just call it Lewy body disease, but they are a little different in that in dementia with Lewy bodies, you get some memory, but not so much memory. It's more visual hallucinations, vivid visual hallucinations. People will tell me how the crocodile is blinking their eyes or the way there's fluff on the end of the rabbit's ears. They're very vivid. And although the crocodile may have been scary, often they're not scary, but they're vivid visual hallucinations. They get signs of Parkinson's where they're a bit stiff and a bit stooped and they can't move so quickly. And memory is often relatively well preserved and they fall asleep really easily. I saw a man on Monday and halfway through the consultation he suddenly just dropped his head on and went to sleep and snored. In the middle of our clinic, and his wife said, yes, this is what he does all the time. That is pretty typical. You see that in dementia with Lewy bodies. Frontotemporal dementia, you see it in younger people. It's not common, fortunately. You see it in older people as well because it's quite hard. That's when people make really odd decisions if they have the frontal variant. If they have it in their temporal lobes, they get speech problems. And it's almost like they've had a stroke. It's not that common. Parkinson's disease with dementia, you can get dementia on top of Parkinson's disease, and there's lots of others. Recently, a former head of Woolworths, it was in the paper I think 2 weeks ago, died of Creutzfeldt-Jakob disease, like mad cow disease. Fortunately, it's rare and it's rapid, and it's very unpleasant. But it's not that common, whereas ARBD, alcohol-related brain damage, is. And the good thing about alcohol-related brain damage is that if you stop drinking the alcohol, the brain damage often stabilises. So, there's people who have to decide, is it the brain or the bottle? Different people think different things. So they're just, look, there's 120 plus types of dementia, but they're the common ones. They're what we see. I work at Hornsby Hospital and I work down in southern New South Wales in Batemans Bay and Moruya and in Armidale in northwest New South Wales. And I see all these, but by far the most I see are Alzheimer's disease and mixed dementia. That's by far the most common. You've heard some of the stats from Councillor Philpott already. A lot of people with dementia. 1,800 new cases a week, they say, and as I said before, it's common. 1 in 12 when you're at 65, 1 in 4 at 80, 1 in 2 at 90. And most people in this room wanted to live to 90, so I think that's really important. It is actually the leading cause of death now for women and the second leading cause of death for men. So this is the commonest cause of death in Australia, and we still don't know a huge amount about it. So that's why it's really good you're here today, and that's why we're here today. Causes a lot of disability in the over 65s, and there's around 25,000 people under 65 with dementia. My youngest patient was 31 and 6 months pregnant when she came to me. She had pure Alzheimer's disease. She was just really unlucky. She had a mutation, a genetic mutation. Neither of her parents had it. They were still alive and working, and her daughter did not have it, the daughter she was pregnant with. Really, really sad case. But this is, you can see it at a very early age. More common in the 40, 50, 60, 70-year-olds, but it's often misdiagnosed. Now, risk factors. What can we do to prevent, this is Alzheimer's disease, but it sort of goes for vascular dementia and mixed dementia as well. About a third of cases of Alzheimer's disease are related to 7 modifiable risk factors. And Sharon's going to show this slide as well. And I often say to people, this is probably one of the most important slides. It's probably the most boring, but it is really important. Have a look at what is on that list. Diabetes. Okay, we can treat diabetes. Midlife obesity. You just look around you when you go into the shopping centre. We have major problems with midlife obesity. Low cognitive activity. That's sitting staring at a television all day, not being involved like you guys are now and actually being involved. Midlife hypertension, high blood pressure, that's not treated. Depression. Quite interesting that 11% of dementia can be related to depression. And then the last two, smoking, 11%. It was 14% when this analysis was done first, which was about 9-10 years ago. But because everybody's decreased their smoking, the risk has also decreased. And Australia is really good for smoking. And then the last one is the really important one. 21% of dementia is due to low physical activity. And that's what's really important. That's what we can do a lot about. It's interesting because The Lancet, which is one of the premier medical journals in the world, last year in July they had a Lancet Commission on Dementia, and they published an incredibly comprehensive, and I would have to say quite boring, report on prevention, intervention and care. You can download it if you are so inclined, but it is the best summary of what we know currently on knowledge in dementia. And I think this pictogram below it really says it all, that 1 in 3 cases of dementia could be addressed, and it can be prevented, and you can do it by increasing education, physical activity and social contact. Well, you're doing the educational social activity now, so that's really good. And if you walked here, and I don't know how far away, some people had to park, but I'm miles away, that's really good. And you can do it by decreasing hearing loss. So hearing loss in midlife is now turned out, it wasn't on the first slide on the previous study, but it is. Hearing loss is felt to be strongly a risk factor. Hypertension, you heard that before, obesity, smoking, depression and diabetes. So exactly the same factors, and it's really, really important that we address those. Does it work? Does prevention work? There is one study called FINGER, and it's short for the Finnish Geriatric Study, and it goes on. But what they did was they took 1,260 older people who had risk factors for developing dementia, and they randomly allocated half to a program in which they really modified their diet, they did lots of exercise, they did cognitive training, and they monitored their vascular risk factors like their cholesterol and their blood sugar and their blood pressure, versus people who just were given advice about good health. And after 2 years, there was a clear difference in cognitive thinking, memory and thinking, in the group who were doing the active, who were doing the exercise. Now that study continues, but I think it gives us, if you like, proof of concept that in a randomised trial, that's the gold standard, you can improve your risk. And in fact, there was a significant difference between the two groups after 2 years. So basically that's my message in terms of prevention. The lady in the top left-hand corner is Ruth Frith. Ruth Frith was an Australian. She's died as well. I think she died at 104. She was still riding her exercise bike just before it. She took up exercise at 75 because she thought she was being a couch potato. So it's never too late. And she held world records for javelin, shot put, discus and hammer throw. And she held, including into her 100th year. And then the others are particularly around just staying active. You know, they say playing a musical instrument, learning a language, eating well's in the centre, because I think that is important. But staying involved is really, really important. Thank you.